You're listening to the Movement is Medicine Show, a podcast hosted by Head to Toe Spine and Sports Therapy, a modern manual therapy practice in Edmonds, Washington. Now, let's get into the show. What's up, everybody? Welcome.
Hey.
How's it going?
Good.
Yeah, it's going good.
Dr. Lee, Dr. Tim, Dr. Annie, we are broadcasting from the clinic, our favorite spot to be. And today we're talking about plantar fasciitis.
Yeah,
It's good pronunciation. That was nice.
That
Thank
was
you.
very nice.
Thanks.
It is the hot button right now around here. We are seeing
There's a lot of it.
so many cases of plantar fasciitis.
Why is that? Is it a seasonal spike in activities? Is it because we treat it so well? What is it?
Could be a little bit of combination of both, but
Definitely treat it well.
yeah, we do treat it well. but
I think definitely an increase in athletics. Recently, you got high school kids getting back into their sports. You have people getting back into the office after taking their vacations from the summer. Even like prolonged sitting can oftentimes cause plantar fascia pain to a lot of people. But yeah, I mean, there's a couple different factors. All we know for sure is that we're seeing a lot of it right now.
What is it? Let's just talk about it, because some people might have some of these symptoms actually and not know what they have, and other people maybe have just never even heard of it or not sure what it is. So what is plantar fasciitis?
Well, let's start with kind of how it presents, and it's one of the few things I think presents very much textbook. I think we all agree on that. It's generally, you really feel it when you first get up in the morning and you load your foot, or when you've been, sitting at your desk for a while or sitting in a chair for a while and you get and load your foot. Either of those things, and you feel a real point pain in your medial heel, and you feel burning along your arch. And as you start to warm your foot up, quite often it feels better. It depends on how badly you are off, but generally that's a really classic presentation.
So like if you're sleeping and you get up and it kind of, you limp a little bit, like, and you feel pain, or if you've been sitting like at the dining room table on like a stool and then you get up.
Yeah, it's just that the plantar is, I mean, as we were talking about, there's actually some different theories as to what's happening with the plantar fascia. But because the plantar fascia really supports the load of the foot, and it does get inflamed. And that's when it's extremely painful. So when you first load your foot and your arch collapses down, like you're going to take a step, which is what the arch is supposed to do, and as it collapses down, it stretches out that plantar fascia, which is supporting that base of the foot. Then it hurts because you're putting that irritated tissue under stretch. So you're getting that immediate burning pain.
And then you're saying once it gets warmed up, that pain goes away.
Often. A little bit.
Yeah, oftentimes it'll present like you said, first thing in the morning, right in the middle of the heel. Some people will even describe it as if like they're stepping on a rock, like right in the middle of their heel. And that's oftentimes what I'll just ask patients that, like, if that's what they feel as they walk around. And sometimes they'll say, like, yeah, that's exactly what I feel, like there's something in my shoe. So that's really common. And like just banking off the plantar fascia that Annie was talking about, fascia is like more a proprioceptive organ and a transfer of energy type of organ. It's not supposed to contract and hold things in place and make things super powerful. It's more so to tell the body what your foot's doing in space. So when its primary job is to actually support that arch, that's when we start to notice the pain, and then it becomes symptomatic and issues arise.
Does it show up with particular foot shapes more often than others? Like, I know that we're not big believers necessarily in like, oh, you have flat feet or high arches, and so you're predetermined to have these particular conditions.
Yeah, I really don't think it does. I mean, I think I've seen it in all different foot shapes, and I don't think one style of foot is predisposition to having plantar fascia issues.
I think a lot of it comes down more so to like your gait, how you're walking, and your muscle activation that you have, especially in your posterior chain. So kind of what I mean by that, a lot of times with plantar fascia, like Lee was saying, like your plantar fascia on the bottom of the foot shouldn't necessarily be having to like support that arch. But once, especially like what I always find with this is like calf muscles, like your soleus and gastrocnemius on the back of your calf, once those get extremely tight, then the plantar fascia has to start to make up for some of that, because you don't have proper foot and ankle mechanics when that stuff happens.
Right.
I 100% have this, for sure. Like
This is like
I'm going on Wikipedia at like 2 a.m. right now, searching out my symptoms, and you just described everything. Like stabbing pain, like a nail being driven through my heel, goes away after I limp it out for a few minutes. Extremely tight calf muscles that like Yeah. Oh.
Yeah.
And the
I'm-
reason
I'm-
for the calf being so tight
Mm.
is because your glutes and your hamstrings, the other posterior chain muscles that are infinitely larger than the calf, aren't doing their job.
Mhm.
You're pushing off your toes. You're pulling your heel off the ground more than you need to, rather than actually pulling yourself through that motion that your hamstring and your glute would do. Could be all starting from your hip flexors being super tight, which is, again, goes into that massive sitting aspect of this injury. If the hip flexors are really tight, they tend to draw your hips forward across your toes, and that puts your calves in a stretch. The calves start to accommodate to that stretch. Your toes start to grip into the ground. That tightens up the fascia. Pain occurs.
And
This-
hello to other things too. I mean, what you've just said describes our low back pain patients, our hip pain patients, our knee pain patients, our foot pain. I mean, that is just such a classic set of circumstances, right? The tight hip flexors, the deactivated glutes, the tight posterior chain.
Yeah,
Hello.
I can't. How many patients we have come in that we have to work on glute strengthening is, yeah. It's such a, like Annie was saying, it's such a common thing that we see for like those patterns to happen, especially like down throughout the lower body. So I mean, yeah, it makes sense that we see that, but yeah, a lot of times with this plantar fascia and other issues that we have in the hip and in the low back and stuff, yeah, those we get on some glute strengthening with a lot of people because they need that.
And I
And
think
glute activation as well. I
Yeah,
would imagine,
activation,
too,
yeah.
to your point.
Yeah.
And I think the big point of, why we're really, really good at managing this condition here is that we don't just look at your foot.
Yeah.
But we do look at your foot carefully. We're going to look at your foot mechanics, your foot strength, both your arches. Lee and I were discussing the lateral and the medial arch, the way your toes work, certainly the activation of your great toe. We're going to look at that fascial chain all the way up where it's stuck. We're going to look at the activation. We're going to look at the counter. I mean, it's not just your foot. And that's where a lot of people go wrong with their own self-care. They may get as far as the calf, and I sure hope they do, because that's a great place to start, is just get a lacrosse ball in your calf and a lacrosse ball in your foot and start getting some mobility in there. But quite often it goes a lot deeper.
Yeah, I mean, that's a great first step, is to kind of get those tissues released, but then you have to look deeper.
All those tissues that are in your foot start below your knee. So your calf muscle is not just your calf muscle. It does everything that your foot and ankle does. It's the extension of those structures. So don't think that, pain's here, I only have to attack here. It's likely elsewhere.
I was in a conversation earlier today, and we were talking about acid reflux with someone, and it was with a naturopathic doctor. And they were talking like for many people when they have like acid reflux and they go to see a conventional doctor, they'll basically get like some kind of a antacid, like an acid blocker type thing, and there won't be any deeper conversation or examination around, well, why are you having this thing in the first place? And it seems like this is one of those things that if you roll, depending on where you roll into, you might just get some foot orthotics or something. Like here's a foot insert, good luck on your way, or change out your shoes and you hear, oh, by the way, here's this insert for your shoe because this is a foot thing.
You're going to get orthotics, a cortisone injection, and maybe my favorite, a night splint.
Ooh.
Just a really fancy Band-Aid.
And that's what you're going to often, unfortunately, that's what you're going to get.
That's the standard. That would maybe be like the standard care kit or kind of.
And, and wear your shoes all the time, including in the house. Never go barefoot.
Could I also maybe get those those really thick looking shoes, like
Get
those?
some Hokas.
Yeah, those with the
Some
giant
Hokas
heel.
or some
Rocker.
shape-ups.
Yes.
Get some Skechers shape-ups.
Yeah.
Yeah.
Oh, yeah,
There you
Barry.
go.
Those
Oh,
are really
Barry.
solid.
Get some Skechers shape. Oh, I want to see that.
Yeah.
I'm looking forward to
Look
that.
like
It's a
I'm
stylish look.
They'll definitely get rid of your plantar fascia pain, though.
Mm-hmm.
Well, you just had
Put it
that
on my
rock in a
shopping
shoe,
list.
right? Just have a rocker shoe, because then you don't have to.
I was hoping I was
dorsiflex.
going to get a rocker shoe.
Then
out of this.
yeah, that'll look great on you. I want to see you walking down the Edmonds Waterway with your rocker shoe.
Yeah, maybe I'll get a
Rocker shoes
walker
on.
too to go with my rocker shoe. It'll
Keep
just
your hip
be a
flexors
whole-
short.
Next
Yeah.
year. Don't get too far ahead of yourself.
Yeah, next year I'll do that. So we obviously take it different, but that is like if you have that foot pain, a lot of times people think I have foot pain, I need to get something that goes onto my foot or around my foot or is connected to my foot.
Yeah.
But you're saying like so many things in the body, we actually need to go up the chain or down the chain. We need to look elsewhere to see where is this causal and what else is happening here in the system that's
Right.
creating a problem.
And with that, like, you still want to do stuff for the foot specifically. Like, use your lacrosse ball, iron out those arches, the medial arch, the lateral arch, probably more important in this case. A lot of people don't realize that they're supposed to have an arch on the outside of their foot. They feel like they're only supposed to have an arch on the inside. We know for a fact, especially Dr. Anna, we were talking about this earlier, the the last bones on the last two toes, like oftentimes will get very stiff and stop moving in this condition. So we do a lot of release of that area, and self-release with the lacrosse ball is like the easiest form of just attacking this on your own.
And you've done we have some great videos on that you've done with the lacrosse ball.
Yeah, we have a really good protocol here for lower leg injuries, especially for plantar fasciitis and bunion formation. I hesitate to say the word bulletproof, but I'd say it's pretty close. It helps a lot.
It's pretty close to bulletproof.
I like it. Yeah.
I want to add too. I mean, there have been cases I've seen of plantar fasciitis where certainly I don't want to completely diss inserts, orthotics, and footwear changes. I mean, there are times recently I just had a case where I actually had her wear a boot for a week because her tissues were just so irritated and painful she couldn't weight bear on them. And so a boot really calmed that down, and then we jumped into our protocol. And the same thing occasionally with people maybe developing a heel spur where that plantar attaches and you have to shelter that bony spur, because that's something that you just have to cover it. You need either a heel cup or a Hoka, right? A different shoe that is going to give that foot more shelter, and or a surgically altered foot, which we see a lot of that fusion in the great toe, which is just so difficult to return from for foot mechanics, and some things we just can't change anymore. So then we get into inserts, you know, and certainly some footwear. And the other thing with footwear too, I think we've talked about this before, or maybe we haven't, maybe this is the next episode, but we've talked about certainly sort of minimalist shoes as to more structured shoes, and really with runners and distance athletes and just certain types of foot. You know, I've certainly been finding myself putting people into a more structured shoe who have continual issues with their foot. So when they're out walking, they're getting a little bit more control through their heel, and et cetera. And that sometimes is necessary.
Yeah, we did joke about it a little bit, but those Hoka type shoes, the Brooks that are more made for that long distance running, or they're a little bit more padded. Some people do react extremely well to those. I'm not one of those people personally. I'm more of the minimalist type shoe person, but there's some people that try the same shoes I wear and they have the same exact reaction that I have to their type of shoe. So don't want you to get pigeonholed into thinking like, oh, I can't wear these minimal shoes. I must have so many issues. I got a big problem. It's really just take it bit by bit and use what works for you.
Yeah. Everyone's foot is different. And that's why, once again, you know, the doctor is not in the mouse, right? It's not all online, Barry. But
So when
really,
you're
you
having
got to
these-
have your stuff looked at.
When you're having this issue, it can get worse too, right? Like, I mean, is this something that
Oh,
Yeah, if you're not getting treatment for it, and
people
100% it can
people
get
come in,
worse.
they like my recent patient, you can't walk.
Well, that's what I thought. See, I didn't think I was plantar fasciitis because my understanding was like debilitating pain, like you couldn't even walk on it. So I was like, this is fine.
there's varying levels
Yeah.
for sure.
Yeah, but I've seen it extremely acute, and I've seen it torn absolutely as well. You know, so it can really progress into a pretty bad state.
Yeah, I've seen some bad tears.
Yeah.
Especially in athletics, with rugby and just any high velocity, high power sport. You're a lot more likely, especially if you're like doing something like football, where you're pushing into another person, you're tackling somebody, you're trying to overcome their strength. If your foot's in a bad spot and you're not using those glutes, you're not using those hamstrings, you're going to be using your foot and your calf muscles, which, depending on the load that you're using, things can fail if you go too high.
It's interesting. Yeah. Well, when somebody comes in with this, what are we going to do? Like, walk me through our protocol. So, are we going to do like, how do we start? I mean, do we start with a movement thing, and then do we have somebody go through some stuff? Do we have them do some stuff? Do we get in there and see like what's going on with some tools? Like, how do we approach treatment?
Yeah, well, you know, first we got to get people out of pain. That's always our first objective, and really we use really multiple different things to get them there. Generally, always. Especially with plantar fasciitis, some fairly aggressive soft tissue protocols in the beginning on the calf, posterior chain, and foot. Certainly manipulation of the lower extremity and the pelvis, getting the foot moving correctly. Sometimes it is calming it down with an insert, a different footwear change. Certainly laser is fantastic for an acute plantar fasciitis
One of my
case.
favorites.
Yeah, it's great.
Yeah. And then as soon as people can, well, really, we don't even need people to be able to weight bear before we get them more active through their core. So we look upstream pretty quickly, but
I'd say I almost entirely start in the calf and the hamstring.
Yeah.
And like you said, just main objective is to get people out of pain. And usually if we can get range of motion restored, the pain will go away pretty quickly soon afterwards. We already mentioned the big toe being intricately involved here. I'd say every single person that has plantar fasciitis has suboptimal toe dorsiflexion, which is pulling the toe off the floor, pulling it towards your shin. And you should have about 45 degrees as humans. Every time we take a step forward, that back leg, we are dorsiflexing the foot and the toes. And if we can't control that movement, we can't actively get into that range of motion. Every time we expose our body to that, we can irritate structures. We can cause inflammation from that. So a couple different things we're going to look at, but we're definitely going to start in the calf and expanding range of motion first. So even for somebody to just pick up their lacrosse ball and start to do things proactively is going to be very helpful.
Yeah. And it's not, well, I mean, I would say it does take a few visits to get through an acute plantar fasciitis, because it depends on your level of compensation and how long you've had it for, how quickly you've come in and sought care, because quite often people have compensated for a long time. And so we've got to really repair a lot of systems and repattern a lot of muscles to really fix the problem. So
when we look at that continuum of treatability versus not treatable or not responsive, some different conditions, some things respond better, some things don't. So if let's say 10 is very responsive to treatment and 1 is very unresponsive, where would we put plantar fasciitis on the continuum?
10.
With us, I'd put it pretty high up there. Yeah.
So this is definitely something that we see a lot of success with.
This is
Yeah,
entirely
for
a
sure.
condition where you just need intervention and it'll go away. The longer you live with it, the longer it's going to stay around. But it doesn't necessarily mean that you can't get over it quickly at that point. Like I've seen a patient recently who's had plantar fasciitis for over a year, and literally within 2 treatments and him doing his exercise at home on his own time, he's noticed a 90% reduction in pain and doesn't have that. Can actually play soccer again, which he wasn't able to do.
Yeah.
So
It's very treatable. Very true. I mean, we see it all. Like we talked about, we see it all the time. We've been seeing it more and more here. And yeah, I think Lee's pretty spot on with that. I think within 2 or 3 treatments of really diving into that soft tissue work down in the calf and the foot, we really see a great increase in that. It decrease in pain, increase in function, and then we can start to dive into the biomechanics a little bit more so after that. But yeah, very treatable. Very.
Well, you convinced me to make an appointment. I mean, and if you can convince me to make an appointment, then I believe that someone out there right now is hearing this and they're like, me too. I'm coming in too. And as you should.
Yeah.
And I'm going to report back on how this plays out on a future show. And I'm going to tell you, if it doesn't work, you guys are in. You guys are gonna
Okay, so
you'll
we're
have
going to
to
do
hang out there pretty
plantar
hard.
fasciitis part 2.
Yeah.
No, I know it's
coming
gonna.
soon.
It's gonna work. Yeah, I can't wait. I'm so ready to be the next success story on this one because it's so annoying every time I get up.
we shouldn't have pain every time we do a box jump either.
Yeah.
Yeah, that's right. And I think there's a lot. It cues me up always just because I look. It's this. N=1 experience. It's like you are your own test kit. You are your own lab kind of thing. Life is an experiment. It's just fascinating to me how long we as human beings will suffer through things when we know we could go it's like, oh, if I just were go across the street, then I could get help with this. But it's like, I'll just wait for no particular reason and I'll just go some other time.
Right.
I mean,
Pain
people-
isn't normal, and we think that it is in our society.
Yeah. People do that all the time. There's little aches, and I see that all the time. Especially with CrossFit. I do CrossFit a lot, and it's CrossFit Industrious here, and it's just you just hear certain people talking sometimes, oh yeah, this kind of going on when I'm doing this and that, and it's just if you just go earlier on when you start noticing that stuff, it's going to be so much easier to get out of that, and you're going to be so much happier in the long run. And plantar fasciitis is just another great example of that, where it's you start noticing that heel pain when you're waking up or anything like that, just go get it checked out. Like I said, 2-3 treatments, we're going to get you out of pain, and then we'll correct the reason why it was happening in the first place.
Well, right. Let's go. Let's so you don't get it repaired. You deal with the minor pain. 2 years, you're out there doing something crazy on a long run or something, and blammo, major tear or something.
Yeah.
And then it's a huge big deal. It totally derails your life then.
Mm-hmm.
Yeah.
For a long period of time.
Yeah.
You're not doing stairs or hills anytime soon with that.
Yeah. Huge
Oh.
pain in the ass.
Yeah, so just come in earlier.
All right. You convinced me. I'm coming in. All right. So that's what you need to know about plantar fasciitis. Very treatable. Very, very treatable. We love to treat it.
Yep.
We
Yep.
love feet.
Love it.
Love them. Love them. And oftentimes, it's not the foot that is the culprit. It's up the chain, like so many other things.
Yep.
Right.
Yep.
Hips, hamstrings, glutes, calves.
It should
That's
be a
it.
song. That was
Yeah,
almost
that sounds like a song.
It's like a little poem we should make up.
There should be one.
That's a really great
So,
one.
yeah.
Thanks, everyone, for tuning in. Movement is the best form of medicine. And as always, we hope you take this, put it in your life, apply it, reap the rewards, reap the benefits, move pain-free. It's how you're meant to be. We really believe that, and we're here to help you along the way. Until next time, take care. Thanks, everybody.
Thank you.
Thank you.